Hello, everyone, and welcome to our virtual briefing, Identifying and Advancing Equitable Solutions for Musculoskeletal Risk Management. My name is Sarah Isher, and I lead the MSD Solutions Lab at the National Safety Council, and I'm also the EHS manager at NSC. A key tenet we hold at the National Safety Council is that equitable workplaces are safer workplaces. When employees have the tools they need to adapt and scale safety solutions to their unique work environment, they can better empower worker well-being both on and off the clock. This philosophy drives our entire workplace practice. So it should come as no surprise that NSC has honed our focus on addressing one of the biggest occupational safety challenges of our time, musculoskeletal disorders, or MSDs, and that we're doing so in a way that shines a spotlight on the intersection of MSD risk and diversity, equity, and inclusion. Here is what we have planned for today's virtual briefing. We have quite a fantastic speaker lineup this afternoon. First, we are pleased to be joined by our very own Rebecca Martin, Program Manager at National Safety Council, who will deliver remarks on diversity, equity, inclusion, and safety. Then I'll walk us through how to combine these two in the workplace. Later, we're excited to present a panel of experts to discuss the intersection of DE&I and MSDs and hear about insights and applications at their organizations. We have Peter Johnson, Professor Emeritus at the University of Washington, Bipin Kuruvilla, Environment, Health, and Safety at 3M India, and Bobby Watts, Director of Ergonomics at Michelin Americas. We'll conclude with an invitation to upcoming events and debut our new resource. We welcome questions from the audience, and we'll do our best to get to them during today's event or in follow-up communications. If you have questions, please use the Q&A feature at the bottom of your Zoom screen. As safety experts and business leaders, you are well aware of the challenges MSDs present, like tendinitis, back strains and sprains, and carpal tunnel syndrome. But amid the daily demands of our jobs, it can be easy to overlook just how pervasive and devastating these injuries really are. MSDs aren't just the most common workplace injury. They're the second leading cause of shortening people's working years, according to WHO, outranked only by mental illness and substance abuse. What's more, based on the physical demands of low-wage jobs, which have historically been held by communities of color, MSDs are disproportionately affecting certain populations, which is why effective risk reduction strengthens a company's commitment to equitable workplaces. So our vision is a world where all workplaces are free from MSDs and workers can live their fullest lives. Our mission is to inspire a global movement across industries that improves workplace safety, reduces MSD risk, and enhances the well-being of all workers. Our job is to ensure that workers don't just make it home safely at the end of the day, but that when they do, they're able to live their fullest lives doing what they love with the people that they love. We were among the first to sound the alarm on MSDs, and in 2021, with funding and support from Amazon, we established the groundbreaking MSD Solutions Lab to address this under-recognized issue. We recognize that big challenges require engagement across many sectors. We are building a global community to elevate awareness, share knowledge, and promote best practices to improve quality of life, as well as enable business productivity and success. Our 4 pillars of impact include engaging key stakeholders to provide guidance. We've built a dynamic advisory council of experts across academia, corporate contributors, government, NGOs, and solution providers. We research key topics to advance knowledge and provide evidence-based guidance, tools, and insight on issues and trends. We also promote innovation of new and existing challenges, new and existing solutions, programs, and processes to drive workplace change. We scale and share findings by amplifying results, solutions, and insights, prioritizing MSD prevention, and making solutions available for workplaces across the globe. A key component of the MSD Solutions Lab is the MSD Pledge. We launched this first ever employee-led movement in June of 2022 with an ambitious but simple goal: create safer outcomes for millions of workers worldwide by collectively reducing MSD risks and injuries by 25% by 2025. We are happy to say that more than 170 organizations, from multinational corporations to family-owned businesses in communities like yours, have joined us in committing to solving MSDs through the pledge. Our team is looking forward to sharing some exciting program updates about the pledge next month, so stay tuned for that. But the major point I want you to take away is, while each of us represents a myriad of industries and sectors, each presenting a unique set of MSD concerns, we can all agree that healthy businesses start with safe, equitable workplaces. It's why we're here to talk about the social and environment disparities that may influence MSD risk in your organization and how you as safety leaders can build a safety culture to mitigate these inequities. To kick off our discussions, I'm pleased to introduce Rebecca Martin, Program Manager for the Worker Wellbeing Program at National Safety Council. With nearly 25 years of invaluable experience in the realm of public health and social services, Rebecca stands as a seasoned professional dedicated to making a meaningful impact on the well-being of individuals and communities. Throughout her career, she has demonstrated unwavering commitment to the various facets of public health, including maternal and child health, infant mental health, and the pursuit of health equity. Welcome, Rebecca.
Thanks, Sarah. Thank you for having me here. I'm really excited to join everyone. So I'm coming to you from Wisconsin. So I wanted to start with a land acknowledgement. I live in South Central Wisconsin, sort of near those 3 lakes in the middle there of the ancestral land of the Ho-Chunk Nation. Next slide. So a little disclaimer, I have 10 minutes today, which is not nearly enough to go through all of the realms and facets of diversity, equity, inclusion. So I just wanted to start off with a little disclaimer about the fact that there's way more to this than what I can cover today. So I encourage everyone to continue your own exploration of these concepts. So we're going to ground ourselves with some definitions. So when we think about diversity, equity, and inclusion, a lot of times we talk about them as sort of a conglomeration of words. And so it's really important that we understand what we mean when we say diversity, equity, and inclusion. And so starting with diversity, we're really talking about all of the things that make us who we are. So our experiences, the worlds in which we exist, all of the behavioral and socioeconomic factors that turn us into how we think, feel, and interact in the world. So not limited to race, ethnicity, learning or working styles, culture, politics, religion, ability, gender identity, immigrant status, all of those words. So another thing to think about when we think about diversity is that as the YWCA has so aptly said, it's possible to name, acknowledge, and celebrate diversity without doing anything to transform the institutional or structural systems that produce and maintain injustice and inequity. So I want us to keep that sort of in the back of our mind of the ultimate goal when we talk about diversity, equity, and inclusion. Next slide, please. So inclusion is the active or intentional ongoing engagement, involvement, and empowerment of diverse people and groups, providing equitable access to opportunities and resources, assuring full, authentic participation, and the intentional pursuit of creating equitable systems in which all people have a voice and representation. And if you didn't know this about me, I really love quotes. So we have another quote on there from James Charlton, who did a lot of the disability rights work around and came up with the saying of nothing about us without us. So when we think about inclusion, that's really what we're talking about is, does everyone have a voice in what we're talking about? Next slide. And equity. So this is sort of the sum goal of everything that we're trying to attain. And the thing that's really important to think about with equity that's different in terms of other words that we might use, like equality, is that equity is the absence of avoidable and remediable differences. So things that can be fixed. And things that are not naturally occurring, which kind of brings us to the opposite of equity, which is inequity. So when we think about equity and inequity, we're talking about disproportion that is rarely naturally occurring. So when we talk about equity, it is not about things that happen naturally. It is a system that has been built to create inequity. So next slide. So at the core of what we're talking about, we're really talking about disproportion. And so sometimes we say disparity, or we say disproportion, or we say inequity or inequality. And so I have a couple of examples to help us better understand the nuances between these words. So everybody kind of can probably agree that unfortunately, as we get older, we get more gray hair than younger people. So this is disparity, right? There's a difference. There's disproportion, right? So a portion of the population has gray hair separate from a different portion of the population, but it's naturally occurring. So we're not talking about inequity. So then we think about PPE. I know we talk about PPE a lot, but it's a quick and easy example of equality versus inequity. So if everyone gets the same equal PPE, this does not necessarily mean that we are going to have an equitable outcome, right? So clearly bodies are different, people are different. Giving everyone the same PPE does not necessarily mean that we're going to have an equitable outcome. Lastly, like I mentioned, I'm from Wisconsin. We have some of the worst disproportion between Black children and white children in health and education and socioeconomic outcomes in the country. So Black children in Wisconsin were 4 times more likely to be lead poisoned than white children in 2022. So we have disparity, disproportion, and it's caused by inequity. There is no reason, there's no biological reason for a Black child in Wisconsin to have more lead in their blood than their white peer. So we're talking about underlying issues that have led to this disproportionate outcome. Next slide. So our goal then in thinking about diversity, equity, and inclusion is really to reduce this disproportion. So when we think about diversity, our goal with diversity is to achieve proportion in terms of people, opinions, point of view, ways of doing things. So if at your organization, for example, you are looking at a population that is all over 40, or is all male, or is all coming from the same educational background, economic background, region, you don't necessarily have a proportionate representation of the people perhaps that you are serving or that are in your communities. And then when we think about inclusion, it's not enough to just think about whether or not we have proportionate representation. It's about, are the people who we have in our organizations, in our communities, do they have an equal voice at the table, right? Does the leadership match the work staff? Do teachers match the student population, right? So are we having diversity and inclusion? And all of that should lead us to proportionate equity. So health, socioeconomic, safety, well-being outcomes are kind of the big buckets that we think about when we think about equity. And in terms of today, we're really going to be talking about safety and safety equity. So at the heart of this, we're thinking about safety equity. So safety equity is achieved when everyone has a fair and just opportunity to be as safe as possible. This requires removing obstacles to workplace safety, such as discrimination, powerlessness, inequitable supports required to perform a job safely, inequitable pay, psychologically unsafe environments, lack of access to healthcare and other benefits, and language and cultural barriers. Achieving safety equity requires focused and ongoing efforts to address historical and contemporary injustices, overcome economic, social, and other obstacles to health and safety, and elimination of preventable safety disparities. And this parallels the health equity definitions that we have existing today. Next slide. So how do we create work environments that keep everyone safe? So a nice breakdown is if we think about ergonomics, we might have 2 people doing the same job, and one is having a disproportionate rate of injury, illness, incident. We might look at the differences between those 2 people, and that's ergonomics, or my understanding of ergonomics. Sarah can correct me later. And then we have 2 groups of people. So if we have 2 groups of people doing similar jobs, and one group has disproportionate rates of injury, we need to look at those underlying causes, those systemic differences that are leading to those inequitable outcomes, or that disproportionality between safety outcomes. So a good example of this is in the most recent year that we have, Black workers and Hispanic or Latino workers had disproportionate workplace fatality rates of 4 and 4.5 per 100,000 full-time workers, compared to the all-worker rate, which was 3.6. So where we are seeing disparity, we need to start looking at what is causing this and what do we need to do about it. Next slide. So in ways we can think about equity, inclusion, and diversity, we need to know our data, right? So we don't know if there's disproportion if we are not looking for it. So we need to have access to our data, and where we see disproportion, we need to say, what is going on here and what do we need to do about it? So thinking about having an equity lens when making strategic policy decisions, creating opportunities for everyone to be involved, co-creating a plan. So sort of the next step around inclusion is really belonging and co-creation, right? So we should not be having one group of people creating policies for another group of people without those people at the table. It should really be co-creating. So those are sort of the next steps in the path when we think about inclusion and belonging. and diversity. So know your community and your workers. So workplaces and workers do not exist in a vacuum. And what's going on outside and inside the workplace contributes to our health and safety. And so thinking again of what are the things that might be coming through our door, what are the things that are going around our buildings that might be impacting the safety of our workers. So here's the other piece. There's no such thing as being equity neutral. So we are either reducing inequity or we're perpetuating inequity. We're either reducing disproportion or we're perpetuating disproportion. So we need to really be thinking about whether our workplace policies, so those written or unwritten laws, rules, procedures, processes, regulations, and guidelines that govern people, perpetuate safety inequity or eliminate safety inequity. Next slide. So here's just a couple of examples of things that we can be thinking about when we are making our policies that go towards safety. So what decision are we making? We need to be specific and explicit. What beliefs, values, perspectives, and assumptions are guiding how we discuss and consider the topic? What is it that we bring in our own diversity to the table that might be leading us to believe that one thing might lead to another, or that everybody might have the same belief when they might not? Whose voices are we hearing from? Who's are missing? Who will be most affected by our decisions, which also will impact then that inclusion, right? Are they at the table? So are they authentically involved in this process? What assumptions are we making at the foundation of it? What is the impact? So are there any intentional benefits or unintended consequences of the decisions that we're making? And then what's the real impact likely to be for the different groups that are important to your organization? So whether that is your workers, whether that is the community that you serve, what is the outcome that you are expecting to happen based on the decision that you are making? And then what are the things that you can do to revise or change the policies that might address inequity or promote equity? So that was a whole lot of information in a short amount of time. So if you have any questions, you are welcome to contact me. And I'm going to pass it back to Sarah.
Thank you so much, Rebecca, for taking us on a deeper dive into the importance of addressing safety through a lens of DE&I. We appreciate your insights and experience. Before we move on, we'd like to hear from you. A poll with 2 questions will pop up on your screen now, and we'd like you to answer the following questions. Don't forget to scroll down for the second question. So we're asking, have you ever incorporated DE&I into safety practices at your organization? Yes, no, maybe. Are you unsure? And also, who is involved when making a change at your organization? Is it only executive or senior management? Is it middle management, first level management like supervisors, senior staff, or entry level or frontline workers? So take a few minutes to answer those, please. You want to go ahead and have the results pulled up. So it looks like about 40% of you are incorporating DE&I into safety practices. Great start, but we want to get that to 100%. And then when we're talking about who's involved when making a change in your organization, 80% are saying executive or senior management, and that goes all the way down to 30% at the entry level. So definitely room for opportunity there. Thank you for answering those questions. It's great data points for us as well. Now I'm going to discuss how we can bridge the gap to promote diversity, equity, and inclusion in MSD prevention. As an EHS practitioner, this is something that I always strive for on the production floor, but something that really isn't talked about enough. I hope that the discussions today can kickstart change in your organization. Ergonomics is a human-centered practice adapting work environments and job tasks to meet the unique needs of the worker and empower healthier, safer, and more efficient work. To achieve these goals for a diverse workforce, equity and inclusion must be embedded into the core of your ergonomics strategy. At a fundamental level, the facets of DE&I and ergonomics share very similar goals. At the convergence of these concepts, workplaces should be designed with the goal that all people can safely accomplish their jobs, regardless of their identity, sexual orientation, race, ethnicity, age, disability, health and fitness, or other individual factors. As such, exploring connections between DE&I and MSD prevalence is vital to ensuring every employee is afforded the same level of safety in the workplace. A first step to ensuring proper safety for all employees is understanding diversity within a workforce and knowing how certain aspects of work can lead to inequities experienced by some groups of workers. Ergonomics, when properly executed in an organization, has the potential to level the playing field so that all workers are able to perform their job with maximum efficiency within appropriate safety guidelines. Our focus on MSD prevention and ergonomics is keeping things human-centered, so we know that every human ability has a limit. Ergonomics activities define these limits and then design work to be within these limits. We also understand and appreciate that people are different. Ergonomics really centers on understanding these differences to design workplaces that accommodate the workforce. The foundation of an MSD Solutions program is a culture that values worker health and safety, followed by leadership commitment and worker engagement. The goal of this discussion and our upcoming resources is to create an understanding of why DE&I should be a foundational element of an MSD prevention plan, specifically providing what this means and how organizations can provide equitable solutions. Keep in mind the positive impact of programs that address the overall health and well-being of each worker, meeting them where they are and working to enhance their resiliency, providing opportunities for earlier intervention at the earliest signs of symptoms, appropriate, timely healthcare when needed, and overall creating an environment where each worker has agency over their health, safety, and that of those around them. Effective MSD prevention requires a comprehensive approach based on a culture of engaged leaders and workers who actively seek to understand and reduce risk, addressing signs and symptoms of MSDs appropriately, providing robust opportunities to enhance worker health, resiliency, and well-being, and constantly collaborating to introduce, assess, and enhance efforts to create a healthy workplace. So take the time to reflect and ask tough questions. Who is involved? Is it only managers, only first shift, or is responsibility distributed evenly? Positive safety culture. Does your organization have one? Have you completed an employee perception survey? Is the culture only viewed as positive by certain groups of people? And also, are you actively listening to your workforce? If someone has concerns or you notice the workplace doesn't equitably accommodate, are you actually making a change? Factors that increase risk include combining risk factors in a job task, such as high force of exertion and excessive repetition, long exposure to a risk factor, long durations of task performance, or a lack or limited frequency of rest breaks in a repetitive or sustained task. Focus on understanding if members of your teams are more affected by these than others. Are there systems or workplace design at your organization putting some of your workers at disproportionate risk? Really, we want you to focus on equitable solutions. Involve employees from diverse backgrounds in risk assessments in the design and evaluation of controls. Implement workplace design that is adaptable to those with different sizes, abilities, and needs. Translate policies and training to increase understanding for different cultures, backgrounds, and perspectives as relevant to your workplace. Ease working pace requirements to reduce stress, fatigue, and the risk of serious injury. Ensure the mechanisms for pain and injury reporting are accessible and communicated to all employees, and create an environment that welcomes feedback and fosters collaboration. And one of the most important steps after implementing an equitable solution is to really close the loop. So ensure that your job description and physical demand requirements accurately convey the work being completed. For example, if a job once required someone to lift 100 bags of material, which obviously limits those that can do the job, but you've now invested in a vacuum lift to engineer out this risk, make sure you update those requirements. The employees who can do this job are no longer limited to those that can manually lift 100 pounds. This not only creates a safer work environment for those completing the work, but also opens your talent pool to a diverse group of individuals and creates an opportunity for more developmental growth within your organization. We encourage safety professionals to apply the information and examples provided in this discussion to your unique environment. Employers should focus on identifying and advancing equitable solutions that improve jobs with the greatest MSD risk. When doing so, it is essential to include a diverse group of employees, both to understand the job's risk factors and sourcing solutions that are helpful for all. For the workplace to be safe and equitable for all employees, regardless of background or individual characteristics, it is important to understand the facets of DE&I, why they are important, and how to address workplace safety and prevention of MSDs. Despite the increased attention DE&I has received over recent years, these are more than just corporate buzzwords. Studies support the notion that MSD risk factors are exacerbated by lack of workplace accommodations. To make the workplace a truly open and safe environment, organizations must be invested in change and committed to implementing workplace solutions that work for all. So remember, if it's not equitable, it's not ergonomic. And with that, I'm pleased to introduce the moderator for our panel discussion, Nadia Ulamoren. Nadia began her career in the quality, health, safety, and environment field as a crude oil chemist. With experience in developing effective safety programs, she brings her passion for evoking change and improving people's quality of life to NSC as our newest senior program manager. Nadia, welcome.
Thank you for the introduction, Sarah. I'm thrilled to be here. For our next conversation, I'm excited to speak with experts and business leaders who have championed inclusive solutions and a culture of safety to their respective organizations. As a reminder, we welcome you all to submit questions via the Q&A function, and we'll do our best to answer as many as we can before the end of the discussion. Otherwise, we'll follow up post-event. All three of the panelists are experts in safety, ergonomics, and diversity in a variety of sectors. Dr. Peter Johnson is a professor emeritus in the School of Public Health at the University of Washington. He's also worked as a researcher at the National Institutes of Occupational Health in the United States, Sweden, and Denmark. Bipin Kurovila has around 20 years of rich experience in EHS management in industries like chemical, heavy engineering, and food industry. He's been part of developing and implementing EHS systems and procedures according to global and local standards throughout his career. And Bobby Watts, who has over 26 years of experience in the field of industrial engineering, ergonomics, and human factors. Her previous work experience includes roles at UPS, American Express, and Coca-Cola Refreshments. Pete, Bipin, and Bobby, thank you so much for joining us. Bobby, we understand you have a close working relationship with Michelin's DE&I team. Can you please elaborate on why collaborations between safety and DE&I teams are important?
So thank you for having me, Nadia, and thank you, National Safety Council. I'm so proud that you're having this webinar, so thank you for that. Let me get that out of the way. To your point about collaborations and why they're so important, it's about being intentional, and I'll go ahead and warn you, you're going to hear the word intentional from me. If you need a drinking game, that's the word for me. But you have to be intentional as an ergo professional, wherever you are, you need to seek out those collaborations. You need to look to see where your ergo efforts are going to have an impact and vice versa. So when we're talking about collaborations with DEI, we can definitely see how we can be working together. When you have a goal of DEI where it is to remove barriers and create opportunities, that really is what we do within ergonomics. And so when we have those collaborations, there's a lot of reasons why, and the benefits, for example, it allows us to enhance our reach and our efforts. And that's not just for ergo, for DEI as well, because we can help each other. There's also that opportunity of staying connected to those corporate strategies. And I believe from the earlier poll, roughly 80% of the people said that the strategies are being driven by the C-suite. So whether you're in that room at the table, this is a way for us to have that input. So definitely you want to have those collaborations so you can stay close to the people who are making those decisions. And lastly, it's a way for us to show our value. As ergonomists, ultimately, we have to toot our own horns. We have to be the ones that are influencing people. So we want people to know what we can do. So by having those collaborations, it's just another way for us to show our value.
Absolutely, thank you. A follow-up question for you, Bobby. From a leadership perspective, can you share how to foster collaboration dialogue across departments? For example, between the DE&I team, executive team, and operations team, can you share any successful examples from Michelin?
Yeah, so I go back to that word intentional. You have to make the time to meet with people, understand who these people are. If you have to get a roster and say, okay, who is this person? What do they do? Take the time to do that, especially if you're new, because that's that time for you to learn what really makes the corporation or the business that you're in, how it ticks. So for me at Michelin, one of the first things I did was to meet with those main points of contacts for each one of those areas. For DEI, I met with our DEI officer. I was like, "Okay, this is what I do. This is what Ergo does. What do you do?" So we wanted to collaborate on our strategies and our objectives. And beyond that, you really have to embed it in what you do. So for me, it was about embedding it into our Ergo network, saying, here are the conversations I'm having with DEI so that they understand, and making sure that they, as a development process for them, that they understand how we can do so much more than just look at safety. We're looking at productivity. We're also looking at sustainability and DEI. To this day, I still work with our DEI officer, Tiffany Davis, just understanding what her objectives are and how we can incorporate what we do within our Ergo network.
Beautiful, amazing. Thank you so much, Bobby, for reinforcing the importance of these collaborations. We know these relationships are especially important to help overcome current gaps in research that help us better understand and address these MSD disparities. Pete, can you speak to us about what evolutions are still needed in research to address inequities in ergonomics? Oops, you're on mute, Pete.
Got it. That's a great question. You know, the amazing thing is if you look at things out there like bicycles, golf clubs, tennis rackets, they're all designed with different genders and statures in mind. And in the work environment, many things are often designed with just a one size fits all design. And I think we have to be more sensitive to age, race, gender, and sex differences when we design processes in the work environment and tools in the work environment as well, to make them adaptable and think who's doing the task and have it be appropriate for those people. Another thing is just getting the people involved early on when you are designing a process or making changes, because then you're very much more likely to get acceptance and have success whenever you're trying to address some of these diversity, equity, and inclusion principles.
Absolutely. Thank you so much for touching on the progress that can still be made there. With that said, there are many countries that may lack guidance or standards for companies to address MSD risks. Bipin, for companies with a global workforce, what is the role of the employer to act as a steward for worker safety? And can you share 3M's approach with us?
Yeah, thank you, Nadia, for introducing me, and thanks for this question. So first to start with, you mentioned about the guidance and standards. So many countries have minimal regulations or standards on ergonomics or MSDs. For example, I would talk about Asia, like countries like India, Thailand, Korea, or Japan. So there are few basic regulatory references on ergonomics. Most of these are focusing only on a limit of manual lifting of weights for specific population groups or office ergonomics. Where a few countries like Australia or Singapore, there are few regulations like code of practice to use for control of MSDs. So what we do in an organization like 3M, we use a global program on ergonomics applied across the facilities. We have a corporate ergonomics team who are based out of US, and 3M uses a risk-based approach on EHS management. We have tools to screen the risk, and based on the screening, we also do the detailed analysis of high-risk activities. Even the EHS engineers are trained to perform the ergo assessments. So we have the resources and training for a group of people like plant engineers, operations team, OH professionals, and supervisors. And we also have a general awareness training to all employees. We also have a standard work for any change in the process or equipment with respect to the ergo risk involved at the design stage. And risk reduction is a goal every site has to fulfill. So these are actually engaging all employees in the risk reduction process. So we also have some recognition programs at the sites. And there are very good ergo risk reduction improvement projects happening across the region like Asia as well. So thank you, and back to you.
Thank you so much. I do have another tying question for you. We understand 3M's doing a lot to help educate its global workforce about MSD risks and safety strategies. So I wanted to hear a little more about how you make your education and training culturally relevant for your workforce in these different regions.
Yeah, thanks for this question. Again, it's an interesting question. So we have awareness training to our employees on ergonomics specific to MSDs, as I mentioned earlier. So we have some standard training modules available. However, we also follow some different approach based on the region where we are operating. So awareness on the MSDs or ergonomics is a challenge in many sites as there are no detailed guidelines or regulations or codes. So to overcome this, I would give an example of India, where we do the training on ergonomics just like a local festival or carnival, because the people are more connected to the local festivals. So we do small group event with even games and specific sessions in the different areas like offices, production operations, or warehouses. What we also do in this particular awareness programs, we do a lot of involvement. We add the occupational health team. We have doctors, nurses based out of our sites. So when they involved in these awareness sessions, that gives a bigger impact to the awareness as such. And what we have done specially is even the occupational health professionals like doctors, they are also trained on ergo detailed assessments, and they are able to talk to employees on shop floor and connect with them on the MSD factors very easily because they are trained on the assessments. So these are about the basic awareness, and we also have training tools for people who work remotely to make it more interactive, and they can also do the self assessments sitting at their home office as well. So I think these are some of the things we are doing on the training and awareness part.
Wonderful.
Thank
Thank
you.
you so much. Now let's shift our focus slightly to learn more about accommodating the needs of a cognitively diverse workforce. Bobby, we hear that you've taken an intentional approach to include the needs of neurodivergent workers in your strategies. Can you walk us through how you began to address the needs of a cognitively diverse workforce and where you are now?
So firstly, I want to say that I'm still learning. A lot of times people think we need to know everything, but that is not the case. So I'm constantly learning. I wanted to really make that part of my scope. So I'm learning, I'm reading, I'm doing studies and all of those things because I want to be prepared for when those questions come up. And when they do, you want to be able to provide the best guidance. So beyond learning, it's about educating others as well. So as I learn, I share it with our employees, our organization, because there's a lot of people who don't know to ask for help. So trying to show that connection between ergo and how what we can do to help with distractions in terms of noise, what we can do with color. We want people to know that. Again, it shows the value of ergo, but also educate people who probably didn't know that something could be done. Another thing that I'm doing is right now, physically right now, is looking at our design guidelines and our change management process. We definitely want to ensure embedded into our risk assessment that we are capturing all of those human and organizational factors that can lead to that imbalance and can lead to injuries and inefficiencies. So part of that is looking at our design guidelines and looking at our risk assessment tools to make sure that we're trying to be as inclusive as possible. And that does include those cognitive ergonomics challenges. So that is something I'm doing. Am I done? No, because I'm still learning. And it actually is something that I am willing, if anybody there who has been working on this, I would love to collaborate because it's about when we look at design guidelines, it's more than just designing out risk. It's about how do we design to be inclusive. And I think there's an opportunity to be better there.
Absolutely. Thank you so much for sharing about Michelin America's commitment to neurodiversity and workforce inclusion. So important.
Thank you.
Let's now pivot to the broader scope of DE&I centered strategies and their impact on education and awareness campaigns, particularly in the context of preventing MSDs among diverse populations. Pete, How can a DE&I centered approach to education and awareness campaigns enhance the understanding and prevention of MSDs among various populations?
It's a great question. Well, it's really important that people are aware that their age, sex, and gender differences and physical differences and how people work, and to take those differences into account when you design your work. The interesting thing now is we don't have a lot of tools at our access that take DE&I into account. But it's neat. We're starting to get some tools that do that. The ACGH fatigue TLV is one interesting tool that can take gender-related strength differences into account, and you can design the job based on strength differences. Another thing that's important is we age, unfortunately, like I'm aging, we have less strength as we age. So you have to think of the older worker as well, and think about designing jobs that they can age into. I think that's very important now, as we're having record numbers of older and older workers in the workforce that still want to work. So we're going to have to figure out ways to keep them physically engaged so they can still do their work comfortably and healthfully.
Thank you so much, Pete. So I have a question for the whole panel. We'd like to hear about recommendations. So what would you offer to employers on how to approach MSD solutions with an equitable framework? Or what specific tips might you offer for safety professionals so they can more comprehensively center equity in their ergonomic strategies?
I'll go first.
Oh,
So
great.
for me, one of the things I would advise people is to meet people where they are, whether it is the corporation or the employees, because people are going to have different viewpoints on what DEI is, and a lot of that is just not knowing or not having education around it. So meeting people where they are, but also being stewards and supporters for DEI. And proponents, we need to not only embed it in what we do as ergonomists, but we need to be champions for it. So again, it shows our value as ergonomists, but it also helps to bring that synergy where what we're doing for DEI is going to help ergo. So we want to, embed it in what we do because it's just going to be, better for everyone. So being that proponent and that champion for DEI, really getting the word out and help change minds of people. But first, just know that people may have a different viewpoint. Just meet them where they are.
Seems like
Absolutely. Yeah.
another
Please.
thing that seems obvious is just have DE&I objectives with anything that you do. So how is this going to meet our diversity objective? How is it going to meet our equity objective? How is it going to meet our inclusion objective? And if you have a list of items in each of those categories, that can make you more aware and more likely to include it when you do any sort of changes in the work environment.
Yeah, I would like to add maybe 2 points to this. So one is about having a local or regional approach in addition to the global standards whenever specific to education and training. That's one of the aspect. Second thing is, as I mentioned earlier, involve the occupational health professionals and also the engineers who are based out of a plant or projects. So the involvement of these group of personnel is really impactful. So that's my key takeaways.
I was going to
Thank you
say,
so much.
I was going to say another thing, there's a physical aspect to work, but there's also a mental aspect to work. So you can't just treat the physical aspects in isolation. You also have to think of the cognitive and mental aspects as well. And one of the other questions somebody brought up, it's not only looking at what's going on in the work environment, but also what's going on outside the work environment that may be important as well.
Yes. Thank you for bringing that up. So we have time to take an audience question. James from our audience highlights that part of equity is considering factors outside the workplace that contribute to MSD risks, such as driving, personal hobbies, other life demands. How do you, any of you, account for lifestyle or other social determinants of health in your ergonomic approaches? Or how can we?
I would say one thing is you ask people about those activities outside of work and how they may mesh physically with the work that they're doing. And then, you know, the difficult thing about physical disorders is it involves pain, and it's subjective, and it's not necessarily always easy to track. So I always tell people to listen to their body, and their body will tell them if a change was made, if it was in the right direction or not. And often subjectively, what you perceive about the changes and what you physically experience will tell you whether or not that's a change in the right direction or not.
Just to piggyback on what Dr. Johnson said is that making sure that they understand that ergo is not just for work. It's, you know, at work, at home, at play. So educating them on, and to his point, that if they are doing something at home and it doesn't feel good, you know, think of those ergo principles. So just trying to engage and let them know that ergo is everywhere, and just educating them on that.
Yeah. So what kind of DE&I questions could we or should we include in ergonomic risk assessments? What do you think?
I'll go ahead and try to jump in. That is actually a really good question. I think one of the things, you know, from a physical standpoint, I think it's a little bit easier. I thought I was muted. I think it's a little bit easier just to, you know, ensure that those questions are embedded in our design guidelines. Are we excluding someone because this is too high? Are we excluding someone because the force is too much? I think for us, you know, and we're already doing that. So we need to, you know, let's just go ahead and say that first. We're already embedding DEI in what we're doing at Ergo. We just need to highlight for other people, but the opportunity for us is to be better at it. And I think for me, there's a huge opportunity on the cognitive ergo side. And again, going back to neurodivergent conditions. So again, looking at those questions, you know, not just will this cause an injury, but are we excluding people, whether it's any of those characteristics of DEI, just being open to ask those questions.
Absolutely. As we wrap up, any final comments from Bipin or Pete?
No real final comments other than this is a really important issue. It's a developing issue, and we're all students, like Bobby mentioned, that we have to learn how to deal with these issues, bring them more to the fore, and come up with ways of how to treat them and share knowledge and keep improving on the start that we have, recognizing the importance of diversity, equity, and inclusion.
Yeah, I think we hear a lot about DEI now, so we are so quick in implementing. So I think like everyone is interested in implementing that, but consider the factors which can become an issue later before implementing or on the process of implementing. So that's something which we need to think about in the beginning. Yeah, that's from my side.
We actually have some great audience questions coming through. So you've obviously been jogging their brains a bit. So I really do want to share this question from Paige. If some individuals may be more predisposed to suffering from MSDs, such as an older worker or worker of a certain gender, how can we ensure that this is not adversely used against them in hiring or promotion decision?
For me, it goes back to that collaboration, working closely not only with the DEI, but with our HR groups to understand, so that they understand those situations. Hopefully, they are well versed in legalities and in regulations. So just making sure that you have that connection with those groups, so that they understand that if we do something on our end, that it doesn't look like it's penalizing anybody. So again, it goes back to those collaborations to make sure they know what you're doing and why we're doing it, but just to, you know, again, just having that open communication.
Yeah, I would say similar to what Bobby said, you never want to punish safety. So injuries are just a natural occurrence. And if anything, you would like to get people to report them earlier so they're easier to treat and less severe. So it's just creating an environment that understanding that injuries occur at work, and to kind of reward people for coming forward, especially earlier on. So these injuries are more treatable, not to have a negative environment or stigma associated with injuries. They just happen, and especially as we get older, we aren't as fit for fight as we used to be, and you don't want to be penalized for that. You want it to be recognized and have your work environment designed to accommodate the changes as situations changes for people personally.
Yeah, it's also important to have some return to work after injury or illness kind of policy for any organization. So it should have like a proper process of how to engage the employee back into the work. So this is something which Bobby mentioned, as well, Pete has mentioned. So I think a good teamwork will happen so that the person can even return to work after an injury. So that's again another thing which every organization can look into.
Thank you so much. Thank you to our panelists for such a robust discussion. We'll transition back to some content. So given what we've heard and what we know, here are 3 high-level actions you as an employer can take to create an equitable, healthy workplace and reduce musculoskeletal disorder risk. Action 1, address underlying health disparities and promote health equity. Employers can take action by implementing policies and practices that promote health equity, such as providing access to medical care, addressing workplace discrimination, and ensuring that workers from diverse backgrounds have equitable opportunities for safety and well-being. Action 2, collect and analyze data on MSD risk factors for different populations. Employers should also gather comprehensive demographic data, encourage self-identification, and be transparent about the importance of collecting this information. By understanding who is at risk, employers can develop targeted interventions and support systems. In Action 3, ensure ergonomic interventions are inclusive. When implementing ergonomic solutions to combat MSDs, employers should ensure that these interventions work for everyone in the workforce. And this means validating solutions with employee feedback, making solutions accessible to as many people as possible, providing multiple options for work arrangements, and engaging with workers across the organization to inform of these solutions. These actions demonstrate an employer's commitment to not only reducing MSD risk, but also promoting equity and inclusion in the workplace, ultimately leading to a healthier and safer work environment for all employees. And with that, I'd like to pass the mic back to Sarah to close us out. Sarah, back to you.
Thank you, Nadia, and thanks to our panelists for such an insightful conversation. As we continue our groundbreaking work to solve MSDs, NSC is pleased to introduce the next evolution of this first-of-its-kind global call to action to transform workplace safety, the MSD Pledge 2.0. Launching next month, this pledge will be a new opportunity for all organizations committed to safety progress to join NSC at the table in addressing workplace MSDs. Every employee deserves to work in an environment where their safety is valued, and by increasing access to the lab's incredible network and resources through this new Pledge 2.0 initiative, we have the ability to create safer workplaces, healthier communities, and more equitable organizations, so people can live their fullest lives both on and off the clock. So stay tuned for more updates on the MSD Pledge 2.0 in the next few weeks, and we hope you'll join us in November for our summit about this initiative. Thank you again for your continued support, partnership, and commitment to safety improvement and innovation. And we're happy to announce a new infographic series coming soon. This infographic illustrates the link between equity and ergonomics, demonstrating how ergonomic solutions in many ways are, in fact, equity solutions, changing the work environment to meet the unique needs of the workforce. So keep your eyes posted to your inbox. Attendees of today's event will receive a special alert once this resource goes live. And if you enjoyed today's event, we want to offer you more opportunities to engage with us. First, we are just a little over 3 weeks away from our signature event, 2023 NSC Safety Congress and Expo in New Orleans, October 20th through 26th. Join us there for your chance to build professional relationships, sharpen your skills at over 125 educational opportunities, and learn about the latest safety training, technology, and innovations, at NSC Central on the expo floor. If you want to learn more, please click yes on the poll that will be shared shortly. And we hope that if you haven't signed the pledge yet, you'll join us in signing Pledge 2.0 during our summit on November 16th. With your continued support, partnership, and commitment to safety improvement and innovation, we are setting up success to be in an even better position so people around the world can live fuller, injury-free lives. If you would like to pre-register for our next summit event, MSD Pledge 2.0, Empowering Organizations to Transform Workplace Safety, on November 16th, to learn more about our updated pledge and hear from industry experts, please answer the poll on your screen now. And just lastly, thank you again for joining today's virtual event. I appreciate you tuning into this discussion today and hope you've received at least one actionable insight that can kickstart your journey to an equitable environment in your organization. I hope you all have a great day, and as always, be safe.